Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rao. This is the show where we get you all the latest on the pandemic and on vaccines. Later on in the show, you can call in with any questions that you may have. Our doctors will answer those questions for you. Well, let's now take a look at the latest data. And 4,529 COVID patients died in the last 24 hours in India. That's the highest ever COVID deaths in a day. And 2.67 lakh fresh infections were logged as a deadly second wave continues to affect lakhs every day. This is the seventh time since the 12th of May when India has registered over 4,000 daily deaths due to COVID. The country has been logging less than 3 lakh infections since Monday, when the daily cases dropped below the mark for the first time since April 21st. The positivity remains high, the positivity rate at 13.31%. Now, India has crossed US's highest death numbers. The highest daily numbers reported in the US were 4,475, which were reported on the 12th of January this year. Now, India has reported 4,529, crossing their number. Now, the big focus on the show, the latest on vaccines and variants. The Pfizer and Moderna COVID vaccines should remain highly effective against coronavirus variants first identified in India, according to new research carried out by US scientists. The lab-based study was carried out by the NYU Grossman School of Medicine and NYU Langone Center and is considered preliminary because it hasn't been published in a peer-reviewed journal yet. But based on the lab experiments involving cell cultures, B.1.617 variants seem to be partially resistant to the antibodies elicited by the vaccination, according to the preprint paper. Well, to talk more about this and the larger pandemic, we're now joined by Dr. Jeremy Faust, emergency physician and public health researcher. Thank you so much, Dr. Faust, for joining us on the show. Now, there are concerns about the vaccine's effectiveness against the new variant strains, especially the B.1.617, which is dominant in many parts of India, but now new studies with promising results.
So far, what we know is that the major variants of concern do show a little bit of decreased action in terms of the strength of the antibodies against the variants of coronavirus. A little bit of decreased action in a laboratory setting, measuring just how tightly the antibodies attack the virus. What's good news is that the decrease in that binding, that clasp that is between the antibodies and the coronavirus variants, that is really a very small decrease overall. So we believe that even though the variants are able to slip away a little more easily, it's way, way too soon and too early to worry that renders the vaccines to not be effective. In fact, we believe that they're still very effective. And it's a really good thing that in the case of the 3 vaccines that we had in the United States, which is Pfizer, Moderna, and Johnson & Johnson, we know that the antibody levels are very high to begin with when we give those vaccines. And that's true for most of the vaccines around the world, which means that a little bit of decreased attack by those antibodies can kind of be tolerated for the current variants that we have.
All right, Dr. Faust, now currently in India, if we're talking about vaccinations, we are not managing to vaccinate fast enough. The daily rates are down. What are the worries if the rate remains so slow, and will we see more variants emerging?
Vaccinations are the only way we can get out of this crisis. That's the only message that people need to understand, is that vaccines will end this and nothing else can at this point. That being said, vaccines help you prevent a major outbreak like the one that has been experienced in India. But once you actually have a spike like that, you're really trying to play catch up. And so during an outbreak, you need other things to be happening. You need to have the right masks. You need to have distancing. You need to have tests. And you need people to know what to do if they get sick. I know there's a lot of information and a lot of misinformation out there. And so I've been working with people here in the United States. I've been working with an Indian-American medical student named Gurpal Verdi, and he and I, with a team of experts here, produced Indian language documents in 8 languages spoken in India to help the public understand what to do, what not to do. There's so much misinformation. But in the short term, the vaccine question is a matter of proactivity and of public policy. But that's going to reach people in weeks and months, unfortunately. The short-term thing we know we can do correctly is to get people to isolate, to get people to wear masks, to get people to open the windows when they are worried that they're being exposed. Those are the simple things that can really turn the tide against this crisis that has occurred.
Now, what's been a very welcome announcement in the US is that 20 more million doses of vaccines are going to be sent around the world. And this is really, welcome, given that we do know now that no one is safe unless everyone is completely safe.
That's right. And the United States has been really finally leading in one area. During this whole crisis, we really didn't do very well, did we? We couldn't control the virus. We couldn't test for the virus. We did not really show what resources we have during 2020. And so we were the center of the crisis, and it was a tremendous failure. The vaccine story has been different. The vaccine story has been a good story for us and for the world. It went quickly. The science has been good, and it's gone through the correct processes. Politics stayed out of it. And as a result, especially in the new administration that we have here, that showed a real appetite to spread the vaccine, to have the infrastructure, to do the rollout. We've had a very good success rate so far, although we are starting to slow down a bit as well. That means that the United States can do what people expect from us, I think, which is to not just help ourselves, but to help others. That is when the United States is at its best. We could not do that last year. We did not really do that last year to a large extent. But this year, I think now we're trying to, and the vaccine story is a tremendous part of that. 20 million more doses announced yesterday. These will be, for the first time, doses of Moderna, Pfizer, and Johnson & Johnson. These are the three that are available in the United States, because the previous 60 million had been AstraZeneca that we're not even using. So now we're showing the world, I think, the willingness to not only share the vaccine stockpile that we aren't using, but even to some extent the vaccine stockpile that we have for ourselves. And that, I think, demonstrates precisely what you said, which is that this is a global crisis, and it doesn't end when your city or state or even your country has immunity. It ends when the world has immunity, because we are so interconnected.
Absolutely. Thank you so much, Dr. Faust, for joining us on the program. Now, the second focus on the show today, children and coronavirus. This year, more and more children have started getting affected by the coronavirus infection as part of the second wave. A majority of children with COVID are asymptomatic. Most have mild illness. 60 to 70% are either asymptomatic or have very mild disease. Doctors say more children are being infected this time because of a host of reasons. It's not just one, but it could be because the more infectious variant that is seen behind the second wave. Everyone also became very careless after long lockdown, and people were moving around more freely. Also, low numbers and more testing is available this time around. So that is one of the reasons that we could be seeing more children, being detected with COVID, as many asymptomatic cases are also being tested. But what is a worry is another issue, that multi-system inflammatory syndrome in children, or MISC, is also being seen more frequently in this wave. It still remains rare, but more cases are being reported in children who develop MISC. Some organs and tissues such as the heart, lungs, blood vessels and kidneys become severely inflamed. Well, to talk more about this and about children and COVID, we're now joined by Dr. Shakuntala Prabhu, Medical Director, Vadhya Children's Hospital, Mumbai, and Dr. Sameer Dalwai, practicing developmental pediatrician and member of the Maharashtra Pediatric Task Force for COVID. Thank you so much, doctors, for taking time out and joining us on the show today. First and foremost, Dr. Shakuntala, I'd like to ask you this question that many are wondering whether we are we seeing that this particular variant is more, it causes more disease in children, or is it just the absolute numbers, given that we've seen over 3 lakh, 4 lakh people being infected every day, that of course then the total number of children being infected will also be high?
Yeah. Hello. Yeah. Good afternoon, and thanks for the invite. In the second wave, we have definitely seen more number of children, and they have come with a little varied symptoms in form of fever lasting for more than 3 to 4 days, and besides the cough, cold and usual typical viral symptoms, they have also come with abdominal pain, loose motions, vomiting, and this was during the active COVID. And post-COVID, we are finding children with persistent fever, skin rash, red eyes, red lips, and children coming in shock-like stage and hypotension and needing support. So this was the post-inflammatory syndrome that we find, or MISC that we call. These children are presenting with these symptoms. The case fatality has not been very different than the first wave. We have been able to recognize these early and treat them appropriately, and the outcomes have been good. So the numbers are definitely more in the second wave and the mutant strain, but we have been able to save, except those children who come with comorbidity. So if they have other illnesses like cancer or kidney problems or heart problems, or children with neurological diseases, when they do get COVID, their systems don't cooperate that much, and they do come and then we have had a few fatality in them. Otherwise, generally, it has been this that we could recognize early and treat early.
All right, Dr. Sameer, your experience in the second wave, more and more children are being affected, though many children remain asymptomatic. And also about this MISC, what are the sort of symptoms that you would like parents to watch out for?
Good afternoon to all of you. And my teacher and senior, Dr. Shakuntala, has already delineated the symptoms. The point here to remember is the child may not have had COVID identified COVID earlier, because like you rightly said, many children are asymptomatic. So it is a child who has been asymptomatic but had COVID earlier can also get the MIS. So you would not be, you don't have to depend on the child whether he had COVID earlier or no. Okay. And hence really any child who's got prolonged fever, high grade fever, who's dull, who's listless, who's got red eyes, red lips, who's got skin rash and is not doing too well, you need to consult your pediatrician or family doctor ASAP. And in fact, the task force in Maharashtra, which has been formed by the Honorable Chief Minister of the state, has already prepared a document and a guideline for what should be the medical system. Now, two important issues here. The most important issue is parent education and educating the public at large that a child with COVID, most of them will be asymptomatic, and those who do get symptoms, most of them will have mild symptoms like a mild fever, mild cough, mild cold, some amount of vomiting, loose motions, wherein you don't need to rush to a hospital, but you need to be in touch on telehealth or on the phone with your pediatrician or family physician. In fact, the task force has even made a kind of a small chart that you can use for home monitoring. If the child continues to have fever beyond 4 or 5 days, or if there is severe worsening in terms of breathlessness, the child not eating, the child having a lesser amount of urine, and a change in the behavior of the child, a cheery, playful, mischievous child suddenly becomes very dull and quiet, is a very important sign. In that case, then you need to take only that child to a COVID care hospital or a center, and then the doctors will decide appropriately. So both these things are being looked at by the task force in Maharashtra. We are coming out with a lot of literature and videos for parents to calm parents down, not to worry, right, because by and large children won't have a problem. And the children who will have a problem, the government is already, the infrastructure is already being laid out to prevent any problems with them.
All right, that's very reassuring. Dr. Shakuntala, the center has also said that now, where preparations are underway for a third wave, and we know in Maharashtra the preparations are being made, and that this third wave is going to impact children more and young people more. And this has really raised a lot of anxiety among parents. If you could tell us why the government feels so, what are the reasons for this and what does it mean?
Yeah, the first wave affected mainly the elderly population. The second wave, as we saw, affected more of the youth between 30 to 50 years of age, and the children are more protected. They are more now no schools, they are not mixing, and the vaccines are not available for them. So there is a concern that these children in the third wave will be the one that would be hit. But I'm not very sure. We are just it's just a speculation. But we have to be prepared, and with that in mind, the government has told all the pediatric hospitals, and of course Maharashtra has also formed a task force in which we are also a committee member in that, and we are being prepared. All the children's hospitals which are seeing children should increase their beds for COVID care, including oxygen and critical care beds, because the moderate and the severe definitely need timely treatment and management, and the outcomes are really good. So it's not, so we need to support the organ systems. So children who already have some disease and comorbidity need more care, but even the others, as we have already told, the PIMS and this needs support. The mild and asymptomatic can definitely be managed at home. So even now they are planning to have some centers, jumbo centers for children also, and of course the training program that would be needed for all healthcare workers, including doctors at PHCs and nurses. All of them would be trained into how to recognize and triage these children into mild, moderate and severe. And I think we have to be prepared, and that's why the preparation. But I'm not very sure, because even in the first and the second wave, we have got children, and children have been exposed, because even in the second wave, the parents have become positive. So the children have had some subclinical infection. But there is a thinking that children may be getting affected, especially in Singapore now they have seen. But what variant the Singapore seen is the same one that was hitting children here in the second wave. So I don't think
right.
It's
that has
very
become
different.
A whole different diplomatic issue right now. But yes, and that is the reason they've shut down schools, because the variant that was first found in India, they're seeing that more children are getting affected by it. But yes, absolutely, we must have more awareness regarding children, and also less anxiety and just preparedness, as you've said. We'll slip into a short break now, but we'll return, and we're going to open it up for viewers to call in and ask any questions that they may have for you doctors regarding children and COVID. Stay with us. Welcome back. Well, it's time now for a viewer segment on the show, and we have a question from one of our viewers. Karunanandi wrote in that what's the best data on increased incidence and severity in children? Dr. Samir?
So, like we spoke earlier, we are not very sure about the actual incidence, whether this variant is harmful more to the children, or whether because more number of children are coming in now. Let's remember, this is only a year old. And last time, as we said in the first wave, many children were not affected. So maybe this is not more infective. Maybe because the numbers are more, we are seeing an expanded spectrum. So rather than saying that the spectrum has changed, I would say that the spectrum has widened. And we now know that corona can also do this. So the exact details about that are awaited. But I think we don't need to panic whether this is a more harmful or a dangerous variant. Even the previous one was good or bad enough the way you look at it. We have to follow whatever the public health authorities have told us to follow.
Right. We have a caller, Ajay, calling from Andhra. Go ahead with your question, Ajay.
Yeah. Actually, good afternoon, everyone. Actually, the discussion is going regarding child, but I want to drop a question. I got second shot of Covaxin after exhaust of 47 days of first shot. But due to non-availability of proper stock in AP. So, as per fact sheet, the second shot will be taken after 28 days. Please conclude whether taking second shot much longer impacts on development of antibody.
All right, I'll take that to Dr. Shakuntala. He's worried that he got his second shot of Covaxin 47 days after the first shot, and whether that will affect the efficacy.
No, that should not affect, because they say something like 4 to 6 weeks you can take, or even little later. Nowadays they're saying even up to 90 days.
All right, so he needn't worry.
But take your second shot.
All right, so he needn't worry about that. We have another tweet question from Yeske, and he asks, shouldn't children have natural immunization, that is develop immunity over a period of time? I'll go back to you, Dr. Shakuntala, for this, because you were speaking about this earlier as well.
I could not hear the question completely. So,
right, he's asking whether that shouldn't children have a sort of natural immunization, that is develop immunity over a period of time to COVID?
Yeah, we are not very sure whether booster doses would be required, but this can be given in addition to the routine immunizations that we give children. And our experience with immunization has been good, that when we give, it protects. So when vaccines are available for children, we should be giving that to the children to protect them.
All right, we have another caller, Shivanand from Bengaluru. Go ahead with your question.
Yeah, I want to ask, my daughter will turn 18 years this September, another 4 months to go. So should I go ahead with vaccinating her, or should I wait till she turns 18 years old?
All right, Dr. Sameer.
Yes, we know that abroad vaccines have begun for even children as young as 12, and it's only a few days away to 18. Now, if the government authorizes vaccines for below 18, because it's more of a technical question there. Otherwise, I think you should go ahead, and if you're getting it, the few weeks won't make any difference.
Right, but right now, children, people who are 17 and 18 can't actually go on to the CoWIN app and even,
Exactly.
create an account or book a vaccine, isn't it?
Them, exactly.
Right, Dr. Shakuntala, yes? Right, Dr.
Hello.
Shakuntala, you were saying something. Yes, go ahead.
Yeah, the CoWIN app would not accept them. Otherwise, as Dr. Sameer said, in abroad they are giving the same vaccine to even children about 12 years of age.
Right, and when do you think we can expect a vaccine for children? Because we do know that certain tests are being done, and the Covaxin, in fact, is going to start testing on children. But hopefully, we'll get some vaccines from abroad as well that have been proven for children, isn't it?
So the actual issue here is about the availability. Okay, sorry.
Right, go ahead, Dr. Sameer.
The actual issue is about availability of vaccines, and I was listening into your program earlier. We are talking about 20 million doses. Now, 20 million sounds like a huge number, isn't it? But it's only 2 crores, and population of India is 130 crores, and the population of children is about 50 crores themselves. So basically, it's a drop in the ocean. So we'll have to look at really ramping up numbers and local production and getting more and more pharmaceutical companies to be licensed enough to develop and produce these vaccines.
Absolutely. I have time for just one more caller. Vrinda calling from Bengaluru. Go ahead with your question.
Hello. Hi, doctor. I have a question here. My husband and I, we have taken the first shot of vaccine, and we are planning for a baby. So, want to know for how long we should wait, and secondly, should we wait till the second shot is also taken? Both of us are below 45 years.
Dr. Shakuntala?
Yeah, there is presently no vaccine for pregnant mothers, but I think our experience with our first wave and the second wave, pregnant women are not greatly affected. They may be positive, but most of them are asymptomatic unless they have comorbid factors. And even the children born of positive mothers, we have had positive babies also, but they are not affected. They are very mildly symptomatic. So there is no data, evidence, literature-based evidence on this.
She should go ahead with both her doses.
At least from our experience, we can go ahead. Hello.
And should she go ahead with both her doses before planning for a baby?
Doses, yeah. I think at least for the next 3 months after giving the dose, it is better to plan after that.
Okay.
But,
all right, we're completely out of time. So sorry for that. Thank you, Dr. Shakuntala and Dr. Sameer, for joining us on the program. And thank you all for watching. Goodbye.